Oral cancer is basically the malignancy or cancer which is arising in oral cavity. But it is important to understand that what is cancer exactly, because people do not really know what cancer is. So cancer is basically uncontrolled growth of tissue. So how will oral cancer present exactly? So if the patient will present some kind of ulceration or some kind of a lesion, fungating lesion in the mouth, some induration, something hard in the mouth, say tongue, oral cavity, lips, lower or upper part of the jaw, palate, anywhere. They'll feel some kind of hardening or thickening, which will usually be persistent for a period of say more than 10-15 days even after treatment. Actually, it can appear anywhere. Okay, but it usually appears in the site which is most exposed to the inciting agent. Now, what is our inciting agent? Our inciting agent is tobacco, right? So, if people are using the tobacco in a chewed form, they usually keep it in their this pouch, GB sulcus, gingivo buccal sulcus. There's the space between the cheek and the gums, right? So that is the part which is usually most exposed. So there, the patient usually gets some kind of ulceration or some kind of whitening and thickening over there. The other common site is the place where this tobacco mixed saliva actually accumulates. So where will it accumulate? The logic says that it will get accumulated in the most dependent part of the oral cavity, right? So again, buccal, just GB sulcus is the most dependent part. And apart from that, this floor of mouth, the area below our tongue is called the floor of mouth. So this is place where usually the saliva accumulates. So these are the areas which usually get higher incidence of cancer. Symptoms are related to the site where the cancer is happening, the site where the ulceration is happening. So patient will have, if for oral cancer, patient will have usually some kind of ulceration or some fungating mass or induration, hardening or thickening of that part of the oral cavity. If it increases in size, then eventually patient will have difficulty in chewing, swallowing, painful swallowing, drooling of saliva, difficulty in speaking, all these symptoms related to oral cavity, right? Most common cause of oral cancer in India or elsewhere is tobacco consumption and alcohol consumption. And when tobacco and alcohol are taken in, they are taken together, the effect actually increases many-fold. Okay, so it is very important that we curtail our tobacco and alcohol habits, and it's not really very difficult. And we have many good centers which are actually helping these patients with some tobacco sedation clinics. So anyone who is actually interested in going ahead with some tobacco cessation program, they should definitely visit. Diagnosis of cancer is based again on the most important thing is biopsy. In biopsy, we see what is the nature of the distorted cells, and based on that, we classify it. So most commonly, the squamous cell carcinomas are present in or are found in oral cavity. Apart from that, many other kind of malignancies can also be found. Sarcomas can be there, hemangiomas can be there, but the most common thing is squamous cell carcinoma. And so this helps in us in establishing the diagnosis of malignancy. And to see the extent of malignancy, imaging is required. Imaging for oral cancers, the imaging is either CT scan or MRI. CT scan is usually done in areas where bone is more prominent, and MRI is usually done in areas where soft tissue is more prominent, say tongue. For tongue, we usually prefer MRI. Then apart from that, the imaging of neck is also done to see whether the disease has spread from oral cavity to neck. And if the disease is a little bit advanced stage, say stage 2, 3, and more than that, then in that scenario, we usually try to screen lungs as well uh, to see whether the disease has gone to some distant part or not. The mainstay of treatment for oral cancer is surgery. In today's time, surgery is the main line of treatment and it has shown the best results. Surgery can be augmented or can be uh, can be helped with some other adjuvant line of treatment such as radiation and chemotherapy, but surgery is the mainstay of treatment. We really do not have very robust evidence, but a good lifestyle, a healthy diet, diet rich in free radical scavengers and antioxidants. Uh, these diets actually, many a times, they do help in reducing the incidence of malignancy in general. Uh, some herbs have also shown some benefit in curbing the incidence of oral cancer malignancy, especially curcumin. Curcumin has really shown some potential. Curcumin is basically found in haldi. So these are some things which can be of help, but the evidence is really not very much in favor against. It goes without saying that a healthy lifestyle definitely helps in curbing the incidence of cancer.